Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Welcome everyone to our Prevent Connect web conference today, What's in a Frame? Communicating effectively to get attention for sexual violence prevention. My name is Ashley Klein-Jimenez and I am with Prevent Connect. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So we have some objectives for today, and that's really to look at describing the components of an effective message, to be able to share experiences of communicating about prevention with different audiences, and then to discuss how strategic communication strategies can advance the work that we're all doing in our communities. And I know for me, I've really been looking forward to this conversation because as passionate as I am about primary prevention, that passion hasn't always translated into being a good communicator to people outside of this work. And so on a very individual level, I often find myself wanting to describe the work that I do, but also thinking about how I should frame it to the particular person that I'm talking about. And if any of you have had that experience, I'd love to know if you just raise your hand and let me know if you've had similar experiences of thinking like, how can I get prevention across in a way that's going to make sense and also get this person on board. And it's great to see that I'm not alone in that. So thank you all for validating that you've also had that experience. But I want to introduce you to our presenters today because they're the ones that are going to give us some great information about how we think about communicating about prevention. So Pamela Mejia is the head of research for Berkeley Media Studies Group, and Laura Palumbo is the communications director at the National Sexual Violence Resource Center. And Pam and Laura, I want to pass this over to you, and then also feel free if you want to do a deeper dive into introducing yourself, you are welcome to do that. I'm going to go ahead and give you that podium though.
Ashley, I'm actually going to ask if you can hold on to the podium for me. I'm having some issues with my iLink.
You got it.
So if you can just move.
You got it.
Okay, can you hear me? Sorry.
Yes, I can.
Okay, perfect. Yeah. Hi, everyone. Apologies for the slight technical glitches that I'm having over on my end, but hopefully those will be resolved soon. And in the meantime, and as always, I'm really delighted to be here and talking with you all. My name is Pamela Mejia. I'll be telling you a little bit more about Berkeley Media Studies Group and what we do later on. But just to give us some context for what we're going to be doing today, obviously first Laura and I will be introducing ourselves and sharing a bit about the background of this work. Then Laura's going to talk us through some of the context, which I'm sure many of us are very aware of, but it never hurts to get us all on the same footing, as it were. We'll talk a little bit about developing communication strategy and overall strategy, which as we'll see is pretty integral to anything we want to do around making prevention visible. We'll talk through a little bit of framing. Framing background. I'm sure many folks on this call are familiar with that, but I do always like to give some sense of where we're at and what we're thinking about when we talk about framing, and especially framing as it affects messaging. We'll talk about steps in developing your message, and I'll have an opportunity to share some findings from some exciting research that we've been doing, public opinion research that gives us some insights into what's most impactful. And finally, we'll have closing thoughts, and discussion. And throughout, one of the things that's so great about Prevent Connect is the opportunity to engage and interact as we've been doing so far. And so we'll be asking, and I know that there's a lot of knowledge and richness in this group. Even just looking at the chat bar, I can see that. So one of the things that we'll also be doing is really trying to make this as much a discussion as possible and having some of the polling questions and discussion back and forth and hearing what's worked for you and what hasn't and what your experiences and opportunities have been. So Ashley, if you could move to the next slide for me. Thank you. Just to start out, Laura and I, there's a lot of us in this virtual room, and Laura and I are not in the same space, but we're also in sort of a virtual room together on this work, and there's a lot of other folks here with us in spirit or kind of not physically present, but who were certainly part of and integral to making this project happen. And I want to just make sure that we say something about them. First, of course, our work was funded through the Centers for Disease Control and Prevention. I want to thank all of our colleagues at Berkeley Media Studies Group, the National Sexual Violence Resource Center, Reliance, which is a multi-coalition collaboration that includes CalCASA, the National Sexual Violence Resource Center, and the Alliance to Prevent Sexual Violence. And I want to thank everyone who's contributed time, feedback, and guidance to this project, including Joan Tabachnik and David Lee, members of the National Coalition to Prevent Child Sexual Abuse and Exploitation, the National Sexual Violence Resource Center Advisory Council, the Association for the Treatment of Sexual Abusers, the Goodwin-Simon Strategic Research Group, which I forgot to put up there. That's totally on me. They've been invaluable, and I want to certainly lift up their work, and will do so throughout, and many, many others whose insights and experience we'll be speaking to throughout. And all of you for being here. We learn something new every time we present and talk through this work, and as we'll discuss, everything we're doing is very, very from the ground up and informed by the lived wisdom of people who do and engage in prevention every day. But before we get into anything else, let me say a little bit about who I am, since many of you may not be familiar with Berkeley Media Studies Group. We are a very small, you're meeting about 10% of the staff today, public health organization based in Berkeley, California. And our work is multifold. We research how the media and how different kinds of media, often the news, but others as well, talk about and frame different public health and social justice issues with an eye towards who's part of the story and who isn't, how are solutions appearing or not appearing, who gets to tell their own stories and who doesn't, et cetera. We use all that to inform the media advocacy training and strategic consultation that we do for community groups, public health advocates, really for anyone who wants to get better at using the media to talk about and make the case for prevention policies and systems change. And finally, we provide professional education for journalists. Now more than ever, I think we're all aware of the role of the media in shaping the discourse, and we know that journalists are doing the heavy lifting in many cases on telling those stories and shaping the narratives that we exist in and tell each other. I want to pass over to Laura now and move to the next slide, if you would, and she can tell us some more about the National Sexual Violence Resource Center and what they do.
Hi, everyone. Thank you, Pamela. So as Pamela mentioned, I'm Laura Palumbo. I'm Communications Director at the National Sexual Violence Resource Center, and I believe I've been working here for 8 years. So I have to double check my math. It's either 8 going on 9 or already been 9 years, but I'll stick to the estimate of 8. And what NSVRC does is that we create tools that translate research and trends into best practices. We collaborate with national partners, state, territory, and tribal sexual assault coalitions, as well as community-based programs and departments of health. And we also work directly with the media to inform news coverage of sexual violence. And then one thing that I can't forget to mention that's a part of NSVRC's work, especially since we are now in the first week of March. Happy International Women's Day, everyone. But you may also be aware that NSVRC coordinates the National Sexual Assault Awareness Month campaign, which will be coming up in just a few weeks in April. And we know that Sexual Assault Awareness Month is often a peg for news coverage, events, outreach efforts, and we're excited to offer the communication tips and tools that we're talking about on this webinar today to help you all make the most of the prevention messages that you share during your SAM campaign. So before we dive into today's discussion about getting attention for prevention, I'm going to give you all a quick background on NSVRC and BMSG's work together in our partnership and what to look forward to as that project continues. So we've been, 5 years ago, we began our work with BMSG, and this work began with the goal of helping our partners in the field to reframe the public conversation about sexual violence from a focus on prevalence to a focus on prevention. We really kept hearing from our partners in the field that that prevention was missing from the public conversation, or when it was presented in the public conversation, it was presented in a misinformed way, really sending mixed messages about risk reduction and victim blaming, and that true primary prevention was absent from the conversation. So throughout these 5 years of collaboration, BMSG has sought out insights from voices in the field to understand their experiences as those engaged most deeply in prevention work. And this has included many listening sessions, interviews, and presentations. I'm sure for many of you in the room today, you've heard Pamela share about BMSG's work, our collaboration and partnership before. She has been a great ambassador for this work in many, many different settings, and their team has spent so much time hearing from the field. And beyond the field, we also wanted to better understand the public conversation on prevention and sexual violence. And toward that goal, BMSG conducted a news analysis, which was released in 2015, and that is the publication that you see on your screens now. It's called What's Missing from the News on Sexual Violence. And this publication looked at how sexual violence is presented in the headlines and portrayed in news coverage, and we were able to really use this analysis as an opportunity to capture a baseline of how significant the gap is in the general public perception of sexual violence, and how rarely prevention and solutions are a part of that conversation. So this news analysis was released in 2015 and actually catalogs an earlier period. I believe most of their research was happening from 2012 to 2013, so definitely a very different media context than the one we're in at present, but it is still absolutely a fascinating resource and gives such a great overview on how sexual violence has been presented in the news for decades. And what we're going to be talking about today, oops, skipped ahead, is since the time this news analysis was released, we've been partnering with BMSG to provide many presentations and trainings on the findings of the news analysis, and to really elevate the conversation in our field about how sexual violence is framed and how those frames have implications for our prevention work. So today what we'll be discussing is this new tool that you see on the screen, Getting Attention for Prevention, which has emerged from our partnership and offers a set of guidelines for effective communication about preventing sexual violence. And what you have to look forward to coming this August to an NSAC near you, BMSG, NSVRC, and our partners at Reliance will be releasing a comprehensive guide to prevention messaging and strategic communication. So the tools that we're going to be talking about in today's guide offer a sneak peek towards this comprehensive tool we'll be releasing in August at NSAC. That is the much anticipated final product of our 5-year collaboration with BMSG. And this tool is very exciting in that it draws from public opinion research that Pamela was mentioning, which included focus groups, in-depth interviews, online surveys, where we tested the strength of various messages, stories, and storytellers to really understand what built sustained support for prevention. So we're very excited for that guide to come out, and it provides an in-depth overview of strategic communication as well as guidelines and sample prevention messages, and how to shift those messages for specific goals and audiences. So that is a very exciting tool, and again, glad to offer you a sneak peek today as we discuss the recently released Getting Attention for Prevention guide, and this guide that you see on your screen is currently available on both BMSG and NSVRC's website.
Great, thank you, Laura.
Yeah. And now to set the stage for this discussion on getting attention for prevention, we knew that we could not start talking about strategically communicating about prevention without acknowledging the current media context and the broader cultural conversation. So when we talk about strategy, We know that messages never stand alone, and that's something that you'll be hearing from both Pamela and I today. And I think we can all agree that we're currently living in a moment when it comes to public attention to sexual assault, sexual violence, sexual harassment, and it's been a moment that's been building for a number of years, and those years, interestingly, really coinciding with the time that NSVRC and BMSG have been collaborating and looking at how this issue is understood by the public. So what you see on your screen here is references to the Harvey Weinstein case, Me Too movement, the recent Larry Nassar trial, and the ongoing national debate around Title IX and sexual violence on college campuses. And this is like really just a broad overview of the current context. There are so many ways that this issue is currently being discussed, and it has really shifted into being a prominent feature of news coverage at the national and local level. And what's been interesting is in the lifespan of this project and our partnership, we've really seen sexual violence become more of a fixture in the media, starting with the Jerry Sandusky case, then the Steubenville trial in Ohio, the growing focus on campus sexual assaults, and the Bill Cosby hearings, the recent presidential election, and now this Me Too moment. And so what we are seeing is just a very alive and constantly shifting media context and public conversation that we always kind of need to keep in the foreground when we think about how we are presenting this issue and representing our work. And so that's all to set the stage for today's conversation. And now I'm actually going to pass it to Ashley so that we can hear from you all about some of the challenges that you faced when it comes to communicating prevention.
Yeah, thank you, Laura. So we would love to hear from you all about any challenges that you face when it comes to communicating about prevention. You know, I shared at the beginning that I definitely face challenges, even when I'm just talking about prevention on an individual level. So we'd love to hear from you all what some examples are that come up in your work. And Laura, I think, thank you so much for providing that media context. I think it's interesting too that there's so much new conversation around the issue, but there's not a lot around prevention. So that's something that I think is, you know, telling as well, is how, you know, how do we communicate about prevention? So Laura and Pam, folks are answering, and so I'm seeing that, you know, there's a lack of recognition. There's some barriers in measuring success of prevention. People think that risk reduction is the same as primary prevention, so really being able to like explain that pivot can be difficult. It's not a priority for some people. It's hard to get folks who maybe have more institutional power on board about prevention. And then just I think that this is one that I've heard a lot, is people just thinking that violence, this is just how it is. This is how human behavior is, and we can't do anything to prevent it. It's inevitable. So those are some things that folks are saying. There are many more comments coming in, so please continue to share. It's great to hear. But I'm going to pass it back over to you all now.
Yeah, actually, Ashley, again, my computer is still acting up, so if you could hang on to it for me for a second, and I'll let you know when to switch slides. Well, thank you so much for that context setting, Laura, and also thanks to everybody for contributing so much. I unfortunately can't see all the comments quite yet, as my laptop is still giving me a bit of grief, but that's okay, because Ashley summarized some of them. And you know, the other thing is a lot of the things people are saying are things that I think are really a common experience in talking about prevention. So what I really want to, first of all, lift up and acknowledge is that we know this stuff is hard. It's really challenging to communicate effectively about prevention. It's hard to communicate about sexual violence in any event because there's a lot of discomfort, and people don't want to think about it. So but the first thing I want to just sort of say, and I don't think it's news to anyone on this call, but I do just want to reiterate it, is that the way we communicate about sexual violence really does have a huge impact on how our audience understands the problem and how they understand what to do about it, right? So, and I want to emphasize that, that what to do about it piece, because I think a lot of times that the focus ends up being on talking about the problem, and that's an important piece, as we'll learn. And with a problem this big, and that it feels like it's such embedded into every part of our lives and our culture, it can feel like conveying the magnitude is the key issue, and that's important, but it's not enough, and our communication can't stop there. And I will add that I just got my computer back online, Ashley, so if you want to hand me over the podium, I think I should be able to wrangle it now. Let's hope for the best, everyone. Yes, I know. So let's see what I can do now. Anyway, so the first thing I want to do is really, first of all, thank Laura Palumbo for generating this image for me. I have no particular visual acuity. And I want to start by saying something, or reiterating something that Laura said before, which is that messages never come first, and they never stand alone. Our most persuasive messages, our most persuasive communication, whatever venue it's happening in, it comes from an overall strategy, the change that we want to see in the world and the way that we think it's going to happen. So messages about preventing sexual assault and sexual abuse, human trafficking, the whole range of behaviors we know comprise sexual violence, those are really going to derive from the change that we want to see in the world, the changes we want to put in place wherever we are, whatever we're doing, wherever sexual violence is happening in our lives, and we want to see it stop. And that means if messages come from a context, that means that messages have to be considered in tandem with that context. So we need to think about who's delivering them, the messenger, who they're being delivered to, the specific audiences, whoever that is, whether it's the general public, whether it's a school board, whether it's a funder, whether it's a policymaker, a group of parents, whoever it is that we're talking to. And then we also need to understand the political and the cultural context, which Laura so adeptly outlined earlier, that it's happening in. And those influence how they're understood. Right now, the Me Too movement means that lots of people have a sense of, may have a lot of sense of the prevalence of sexual assault, but again, it may contribute to that sense of it as just an inevitable fact of life that we just have to cope with the after effects of. And that's part of why I want to just also say that messages really need to be fluid. You know, our strategy is going to be changing, our messengers may change, our target audiences may change, and the context around us is always changing. So again, I say all that to say that, to give some sense of why now we're going to take a little step back and talk a bit about this concept I've introduced, this of overall strategy, right? Overall strategy is really answering questions like, you know, as we're thinking about strategically messaging prevention, let's think about how strategic communications work. And again, this overall strategy piece is going to encompass questions like, what's the problem, who can make the change, and who are your allies? Right? And again, I kind of intimated who some of those things might be, and I imagine many of us here can think of answers to those questions right off the bat, where there is no dearth of strategy and strategic thinkers in this work. Only then do we want to start getting to communication strategy. So just thinking about what's the best way to reach your target or your audience. I'll use the phrases target and audience interchangeably. I know some people don't love the word target or target audience, and sincere apologies if that's the case. But I'll use the terms interchangeably, as I said. So communication strategy, again, this is going to be thinking about what we're doing, what we're doing to reach that target. So is it going to be through the media? Is it going to be how you show up at a board meeting or with an editorial board or among funders? Then and only then do we get to our message strategy, and that relates to what we're going to say to our audience, our target audience, to help facilitate that systems change that we want to see and to convince them that ours is the right plan, that ours is the solution that's going to make the change we want to see in the world. And finally, down here we get to this question of access strategy. In media, that can mean things like how I get to reach my, how I get my op-ed placed, or in other contexts, how I get my social media hashtag trending, or what it is that I do to show up at my community or board meeting to ensure that my target has an opportunity to hear my message in the most impactful way and venue. So the big takeaway that I want to emphasize here is that we can't have any other strategy, much less our message strategy, without having an overall strategy. But now I want to hone in a little bit on this message strategy piece, because that's what we're here today to talk a lot about, is what happens when you've got those first two pieces organized and now you're trying to think of what you want to say and how you want to say it. And a key way that we develop message strategy is taking this step back to questioning how we frame the issue. To do that, I'm going to ask us all to play a little game. My 7-year-old daughter, almost 7-year-old daughter, can tell you I'm not much for games, but I'm going to try to do this one. And I want to ask people what they think it says behind this orange box that we see on the screen. Anybody got any ideas? You can put it in the text box. Not seeing anything, although that, there we go. Prevention works. That's right. Yes, that is what it looks like it says, isn't it? But big surprise. You can see again why I am not a children's show host. In any event, we play this little game, right, to illustrate that we don't come to anything blank. Right? What we see, what we hear, what we experience, what we carry in our minds with us helps us contextualize all the new information that we take in. It helps us fill in our orange box. And as the game indicates, that process happens sometimes instantaneously, without us even knowing it. Somebody here in the saying is that the perception is the reality, and that's one great way of conceptualizing a little bit about it. So again, if we're filling in our orange boxes instantaneously without even knowing it's happening, that kind of means that the frames, the way that we're framing things, like the supports that hold up a building, for example, those are really unquestioned and they're unseen, but they're very, very powerful. So put another way, and I'm from the Bay Area, so I of course have to use this image whenever I can. Frames create tracks for our trains of thoughts. And once we're on those tracks or those trolley cars, as the case may be, it can be really hard to get off, to shift our framing to a different perspective than the one that we're assuming or filling in. And that's why it's important that we frame our topic, that we frame our work in a way that will help, not hinder, us in getting towards the change that we want to see. So one of the dominant frames that really pervades our daily life in the United States and in Western culture often is the idea of personal responsibility, the idea that individual actions like alcohol intake or choice of clothing, pornography use, the people that we spend time with, personal morals, those really outweigh everything else, the personal choices we make and the decision and those decisions. It's kind of like a portrait, you can think of it, is it keeps the focus very narrowly on a single person, a single incident, and the people involved in that incident. It really doesn't, it lets us know a lot about very specific individual choices and actions, but not a whole lot about the landscape around it. When it comes to sexual violence, what that means is that the default frame can really keep the focus, as I said, on individual victims, sometimes on individual perpetrators and incidents of violence or abuse, and it might not show us the landscape of the world around us, where those incidences are happening. Far less often do we think about things in terms of that broader context. When the personal responsibility frame can really keep the focus, can really hide the policies, the institutions, the systems changes on college campuses, in churches, and youth-serving organizations, in medical care, elsewhere, that can foster a climate, not only a climate where sexual violence happens, but also a climate that can be changed to help prevent or reduce the incidence of sexual violence. Put another way, when the landscape is obscured, it keeps the focus on individual behavior. It's a lot harder to show what systems change can look like, to have it make sense to people who are used to thinking in things in terms of personal choice and personal responsibility. So it's a lot harder to show that things like qualified trained staff are imperative, to show that the physical structure of spaces can be important, to show that funding for research is crucial, to illustrate that things like the density of alcohol outlets can play a role, or gender inequity as it comes through in the pay gap. And you'll see I'm choosing all these examples intentionally because we're going to talk about some of them later. So a key framing goal for us as we're talking about prevention then is widening the frame, moving out from talking just about portraits and just about individuals to bringing the landscape, to bringing the broader environment into focus so that prevention, policies, and systems that go beyond risk reduction can make sense to people and we can make the case for them. What does that look like? Well, the first thing I'm going to say, as I said at the beginning, is it's easier said than done, and we recognize it's hard, but we're going to give some ideas about how to do that and what that looks like in a messaging context. But right now I want to pass this back to Laura, who is going to tell us a little bit about people who've done that well. And Ashley, would you actually mind handing off to Laura? Thank you.
No problem.
All right. Can you all hear me?
We can hear you, Laura.
Okay, good. All right. So thank you, Pamela, for that great overview of framing. And I thought it would be great for today's conversation to kind of to think through some examples, not only specifically that we've seen in our own work, but that have sort of been in the broader public conversation. And so the case example that I thought we could look at was sort of the initial coverage of the Harvey Weinstein case. It was leaning more toward what Pamela was describing as that portrait frame of, oh, this is one individual, one bad apple who has perpetrated these abuses, these ongoing abuses, and then sort of as the story broke and kind of the coverage continued, it became clear that there was additional victims of Harvey Weinstein who came forward, and that that many individuals and institutions were called into question for protecting Weinstein. That this was something that this was maybe one bad actor, but that they were enabled by not only the lack of action by many individuals, but this by individuals, institutions, and the broader cultural context in Hollywood. And that really became even broader into calling out the culture of silence and abuse in Hollywood as other perpetrators and people who perpetrated sexual violence in Hollywood came to light. And that initial outcry of Me Too really became this national conversation about how the scope of the issue goes much beyond Hollywood, and that although the initial voices coming forward were specific to one industry and one perpetrator, that the scope of the issue was much broader than that. And then how we've all seen Me Too grow into a movement representing sexual harassment and sexual abuse as a systemic issue, and speaking specifically to the fact that Me Too has kind of come full circle and been understood as a movement that Tarana Burke started decades ago, has been an opportunity for us to realize that in broadening the conversation about of systemic sexual harassment and abuse, that the voices that are most often left out of the conversation are the experiences and voices of women of color. And in addition to just the growth of the Me Too movement, we're now seeing it adapted for many different contexts. We're seeing Me Too K through 12. We're seeing in-depth journalism and stories on the restaurant industry, the hospitality industry. We're seeing follow-up stories on sexual harassment in the sciences, in journalism. And there's this potential for further broadening as I'm seeing many examples of organizations and advocacy groups that are using the broad Me Too to look specifically at issues in specific context. we're also seeing, and as Ashley adeptly mentioned in the initial discussion of media, how a lot of the focus still is on prevalence. We are seeing some of it broaden toward prevention steps. We're seeing people asking, what now? We're seeing people talking about policy, the need for policy change, for research, for accountability, and many voices that have been left out of the mainstream conversation have been able to show leadership in the dialogue because of that broadening of the frame. And that sort of leads us to the next segment of our presentation, where we've talked about the complexity of a message, the anatomy of a message, that it's never just what we have to say, but it's what we have to say in a context and who we have saying it. And we've talked about framing and how the framing is how we can strategically change the view of something from an individual issue to being a more widely understood environmental issue, and having an opportunity to zoom out to the complexity of the problem. And now in this next segment, we're going to be talking about what are some of the steps to develop effective messages. And we're going to be walking through these 3 basic steps of naming the problem and really defining the problem, and defining the problem in a way that is specific and acknowledges the specific audience, describing solutions and how we can describe solutions that are understood by folks outside of our field, and how we can elevate shared values to motivate action towards those solutions. And so that is going to be what we dive into next, and I'm going to pass it to Ashley, who is going to start us off with a conversation about values.
Thanks, Laura. So I think I love when things have strategies, because I think in terms of communicating around prevention, sometimes it's the passion that we have that kind of like overrides the strategy that we need to develop. So I love thinking about these steps that we need to take when we're developing a message, and would love to hear from you all in the audience about the values that motivate your work, and then values that resonate with different audiences that you might be working with. And so Sarah says respect, and I think that that is a value that probably, hopefully, speaks across audiences. But I'm sure that you all have lots of different values, so I'm seeing some come in: equality, justice, compassion. Then there's ones like feminism, fairness and justice, inclusion, empowerment a couple times. A lot of you are saying empowerment. A lot of you are saying respect and safety. So there seems to be some themes. And I'm wondering if these are values that motivate your work, or ones that resonate with your different audiences. Maybe if you could specify in your comments what resonate. If there's ones that are values to you that might be different than what resonates with your different audiences, because I think that that's definitely something that I've struggled with. That my values I might have to talk about them differently to different audiences, so they don't put up a wall. So Laura and Pam, from what you're seeing come across the text chat, I mean, do you have any thoughts about these values? These seem like ones that I definitely share with many people.
Yeah, I think that this is, as I said kind of at the outset, I love these conversations. I love the opportunity to share this work, because every time I think we see and learn more, and also get to see the patterns emerge. And I just want to say that interestingly enough, yesterday I was writing a chapter about using values for the message guide that Laura mentioned at the outset, and many of these came through, and as things that have emerged from public opinion research, from the listening we've done. it's interesting thinking about the ways that, about the distinction also that Ashley mentioned, the distinction between what motivates us and what lands well with our audiences, and thinking about that as a component of overall strategy. As somebody in the text chat just said, we hope that these will transcend, but sometimes things are understood very differently. We can think about the way that different audiences understand concepts like equality, for example, and how, if that's the value we want to evoke, how we're going to frame that. Laura Palumbo, I want to see if anything's coming up for you before we dive into some of the meat of this.
Mm-hmm. Well, I love some of the examples that folks are sharing around safety and respect, healthy relationships, or just even like healthy futures for young people, or the idea of investing in the wellness of our young people, and that the right to safe learning environments. I think that these are again some of the ways that we already see our partners in the field kind of problem solving around this challenge when it comes to unpacking prevention for audiences outside of the field. When that language doesn't resonate, maybe creating safe learning environments does.
Great.
Well, thank you so much for all of that, Laura, and for all that introduction, and also for everyone who contributed thoughts and insights. And I appreciated also some of the conversations happening about empowerment, about equality versus equity. I think these are all really foundational and critical pieces of any discussion about messaging that is going to resonate with the audiences that we most want to move. And I want to flag that too. I think that's something that came up a little bit in our earlier conversation about strategy and about thinking about audiences. Sometimes thinking about the audiences we want to move is not thinking about the general public. And so as we're thinking about some of the divided political contexts in which we find ourselves, we may find places where really moving towards values that work for our supporters, or those that we suspect are sort of closer to being our supporters, may be one way to transcend some of the difficulties around evoking values that really resonate with everybody. But let's dive into the 3 steps that Laura spoke about earlier, the 3 pieces of a message that we want to talk about. So the first is naming the problem. And I'll say off the top that how you define the problem affects how your audience thinks about solutions. Because of that default, that personal responsibility frame we talked about earlier, the tendency for many people is to go right to it's a problem of character, of choice, of a bad versus a good person. And so thinking about the way that we define the problem in a way that helps broaden beyond that frame is really crucial if we're going to get to making the case for any of the solutions that we know are imperative in changing culture and changing social norms and changing the institutions we're in to reduce the incidence of violence. And I'll say that I understand no matter what the topic, this is not unique to sexual violence prevention work, people find it easiest to talk about problems. They're right in front of us. They're hard to avoid. And it's, in the case of sexual violence, it's a multifaceted problem that can seem really big and intractable. And it can be very difficult to think about how to break it down into manageable, solvable pieces. But it's really, really important that we do that because of the curse of knowing too much. I call it the curse of the people who knew too much because I like monster movies. Because we know so much about the problem and how widespread and varied it is, it can be really tempting to try and convey the enormity of it and to just say everything that you know about the problem and in the many ways and places that it happens. And it's really important when possible to resist that urge because it's impossible to be comprehensive, to say everything, and to be strategic. That is, to say the things that need to be said to move the change forward. So to make the statement of the problem more clear and understandable, we really recommend that people focusing on the one aspect, the aspect that's most closely aligned to the solution that you're seeking. And we know that let's say, so think for yourself as you're sitting here. We don't have to necessarily put it in the chat box, so you're more than welcome to, because we'll be working together a little bit later to do as much kind of interactive as we can in this venue. So just think about the problem in a recent aspect of your work that you've wanted to focus on, and how that aligns with the solution or the change that you're seeking. Okay. Let's talk a little bit about that change as well. So thinking about the change that you want to see in the world, whatever that may be. And usually it does go beyond individual behavior because we want everyone to be safe, right? We want everyone to be able to thrive, to develop as healthy sexual and social beings. And we know that from our research and from elsewhere that people respond best to concrete examples of prevention and action. I cannot say enough about how much of our research elevated that people want to believe in prevention, they want to be part of it, but when they don't hear examples that make sense to them and are specific, they close down. The problem seems too big, the solutions seem too nebulous, and the sense is, well, then this is just something we're going to have to deal with. Even people who want to be supportive can be kind of skeptical about the idea that prevention is possible. So it's doubly important, even among our supporters, even among the people that are closest to us, we need to be as concrete and tangible as possible so that we can move people a step further on their journey to seeing prevention as an actionable thing that can be part of their lives, that they can do from wherever they are. So I want to say a word about this second bullet point too, because I just used a lot of aspirational language, right? I wake up every day as a person, as a mother, as everything else, with the idea that the work that I'm doing and that we're doing together is built on hope, and the idea that there will come a time when there are no more victims of sexual violence. But I do want to say that what we found from a lot of our research is that extremely aspirational language like ending sexual violence or creating zero-incident environments, that can feel very pie in the sky or unrealistic or unachievable to a lot of people because of that skepticism, because of that overwhelm about the magnitude of the problem. So one thing that can really help with that is is thinking about being both optimistic and realistic. And that means really helping to meet people where they are, to talk about what prevention can look like in the spheres of influence that people have for themselves, in their community, in their school district, in their organization. It can be hard, I know. I've been in a lot of rooms where I talk about meeting people where they are. And there's a sense from many people who've done this work for a very long time feeling frustrated with incremental change. We've been doing this all these years, and what has it gotten us? And I understand that. And I think that the thing to keep in mind is that what we know tends to work best is changing systems in an incremental way, building from the ground up, meeting people where they are, and helping them take maybe one more step towards creating environments and systems where sexual violence doesn't happen. And that kind of cumulative incremental change is what moves us towards the world we want to see. So thinking about specificity and concreteness, what does that look like? How do you know if you're concrete enough? How do you know what that looks like? Well, I'm a big fan of lists and numbers. So one thing I like to say is you can tell that your change statement is specific enough if it can answer these 5 questions. Now, you won't necessarily need to answer all of these in every message, and often you won't have the time to. But if you can do this, if you can bring these if you can answer these 5 questions, then the change you want to see is specific enough. It's not just changing our culture or families doing more, because that's not going to get some of these answers. If you can do this, I'll just reiterate because I think it's so important and I can't say it enough, that being able to answer these questions in a concrete and tangible way is your first sign that you are affecting or attempting to affect a change that's specific enough to actually move people and to get them towards that sense of this is something possible. This isn't pie in the sky. This is something that I can do from where I am. This is something I can do from my home, my work, my life. The last thing I want to say is a little bit about the values piece. And I think for this audience, I don't really need to say a whole heck of a lot about why values matter, because we heard so many times in that chat box and through that conversation about the values that motivate your work and the way that you center them. And I just want to reiterate again that an effective message has to go beyond the facts and the figures. The data is important, but inundating people with data is so unlikely to shift people's thinking. And that's because what we know is that people really don't respond particularly well to facts and figures, especially if they don't line up with what they already believe. They make a judgment or they make a decision based on their gut reaction, based on their values, and then they kind of work the facts and they work the information into a way that justifies or rationalizes that decision. So people respond best to messages that really evoke those shared values that we talked about. And whatever your change is, whatever it is that you want to see happening in the world, connecting with shared values can help people see why that's important, why that matters to them. It can start from a place of agreement that helps to overcome some of that skepticism and that belief that this is an intractable problem that can't ever be dealt with. And this pyramid I'm presenting here appears in the framing brief. It's based on the work of a cognitive linguist named George Lakoff, who talks about sort of 3 different levels of communication. He talks about that, communicating with people at level 1, where we're communicating with them at a values level. Then there's level 2, where we communicate really about the details of our work area, whether that's about preventing sexual assault on campus, or reducing pornography use, or whatever else our topic area is. And then level 3, when we communicate with people at level 3, we're really in the weeds. That's where we're talking about details, we're talking about facts and we're talking about who's going to pay for what, who's going to do what the policy process is going to look like. And that can be very important in some contexts, but what we know is that for most people, they need time to get there. And if we jump in right at level 3 with the minutia and the nitty-gritty, a lot of people will close down. A lot of people won't connect. And it's really, really important that we be thinking about level 1, and we think about how we can communicate people on the level of those shared values, whatever they are, for our audience and for the change that we want to see in the world. Again, it's really easy to get to level 3. That's where most people operate, and it's where a lot of people are at. So I just want to end my little piece before I pass it back off to Laura by reiterating the importance of level 1. That's at the foundation of our pyramid. That's at the foundation of our communications. And whenever we're in a communication space, I always try to ask myself, and I encourage you to do the same, am I communicating at level 1, level 2, or level 3? Which level do I want to be at? And if I'm not at level 1 and that's where I want to be, how can I get there? What are the values I want to evoke? How can I pull back from the nitty-gritty and the details to talking more about the values that motivate why this is important and why this is something that matters not just to me, but to the group or the person I'm speaking with. I'm going to pass it back to Laura now, who's going to take us through a little bit of kind of the putting it all together work.
Yeah, thank you so much, Pamela. Every time I hear just that discussion of how we can really think about crystallizing not only the problem but solutions for our audiences, and then really bring in the bigger picture with values, it is, I think, such an it really energizes me for the potential of how we can further improve our messaging when it comes to prevention. So now in this last third of our presentation, we're going to be talking about putting all these pieces together, putting all of the pieces that we've discussed around messages, around framing, around naming solutions, defining the problem, elevating shared values, and we're going to try to put those pieces together and to have a little time to put them into practice. And so similar to the 5 W's question, Pamela and the BMSG team has provided us with this great set of 3 questions that can kind of serve for us as a test of whether or not our strategy is our message is effectively meeting all of the goals that we've so far discussed. And so these 3 questions kind of again give us an opportunity to check our messages to see if we are really kind of covering all of our strategic bases, and that the outcome would be our desired frame or message. So really, again, thinking about our starting place as what is the problem, and talking about the problem in a way that cues the environment, and that helps people to, again, understand that, so that our audiences understand the context of the problem and the possibility of a solution. And then again, why does it matter? Stating the values, and values that, connecting to those values that motivate action. Because we want people to not only understand the problem in that broad, insurmountable way, but we want them to see the specific dynamics and context at play, and to understand why it matters, and to motivate them specifically through values. And then, of course, never missing out on what should be done, and describing the solution. And naming the solution helps audiences to see that despite the complexity of any problem, there's always something that we can do about it. And by naming our solutions and connecting it to values, we help illustrate that the approach to really helps to illustrate our prevention approaches.
Thanks, Laura.
Yeah, and so now Ashley is going to lead us in an exercise of looking at those 3 basic questions and putting them into practice.
Well, I don't know how much I'm going to lead it, but because I think I need practice with this too. But I thought, let's see if we can try to piece some of this together. So if you want to give it a go, and just what's the problem? Why does it matter, and what should be done? Trying to put those 3 components together that you would convey to an audience that you were trying to move to action. I'd love to hear what your thoughts are, how you would go about doing that. And maybe Pam or Laura, can you give us an example of what that might look like? Mm-hmm. That might be helpful.
Absolutely. You know what, though? I think I might end up cheating a little bit and using something from the framing brief.
That's great.
So you can take a look at this. This is available on BMSG's website. And so I was thinking a lot about this, actually, because again, this is a hard thing to do, especially given that we're not privy to, and we can't talk through here, unfortunately, all the details of those strategy pieces that we talked about. We don't necessarily know who your audience is or what the larger context of the work in your community is. But I would say the example I'll use again is in the framing brief, but it's near and dear to my heart, not only because I wrote it, but because also as I mentioned, my daughter is almost 7 years old, and she's in after-school care. And I've been thinking a lot, in fact, about the strategies that I want to use. I'm based in Oakland, and there's pretty significant funding issues around what after-school programs, including city-funded programs, which serve the majority of students, many, many children in this community, can do. And I've been thinking a lot about that and how we can make the case to the school district for additional support, or for a very minimum prioritizing funding so it doesn't get cut from things like the programs and policies that we know are necessary in the spaces where our children are, youth-serving organizations like after-school clubs, to ensure that prevention is really baked in, that staff have the proper training, that the spaces are physically set up for safety, that training among staff looks like things like identifying potentially risk factors or problematic behavior, not only among their colleagues, but among other students towards other children towards other children. So as I'm thinking about all that, I would say, maybe the problem I would say is it's in the framing brief, it's more than 10 million children participate in after-school programs every year, but not all of them are safe places. Now, if I were to tailor this to my own work, I would want to tailor that more towards Oakland, or at least the Bay Area, because I would want to queue up an environment that's meaningful for the Oakland Unified School District, for the Oakland City Council, or for the Oakland Unified School District, if that was my target. Why does it matter? Well, 1 in 10 kids experience sexual assault before they're 18. It's our responsibility and our moral imperative as adults, as residents of the Bay Area, to foster and protect the children who are the future of this community. And that's why it's so important to support after-school programs in our efforts to prevent sexual abuse or exploitation. We can do that with increased staff screening and training. Now, of course, if I were doing this in real life, I would presumably have a policy or systems change goal, maybe a bond number or some funding that I wanted to evoke. But for the purposes of this, we'll keep it a little broader. Helping those programs improve from the inside out will reach children all over the community, and it'll help create an Oakland where every child is safe from sexual violence wherever they are. So that might be one way that I would try to construct something, because if I'm talking to maybe the city council, they've got a lot of other competing budget priorities. They may not have children in the system. So I want to think of them as residents of this community, as people who have pride in our community and want to build a better, stronger future Bay Area. What are some of the values I can evoke to make the case for why, as they consider the budget and the tightening that it's going through, these programs, this funding shouldn't be on the chopping block?
Thanks, Pam. It's really helpful, I think, to hear you think through how you would construct that message in terms of audience and context. So thank you for giving us that example. So let's see. So Karen says the problem is the lack of recognition of victims and lack of understanding on ways to refer and treat victims in healthcare. It matters because 88% of sex traffic victims report seeking healthcare multiple times, yet go unnoticed. And so what is needed is mandatory training of medical students and nursing students while in school. Possibly adding the recognition and treatment of victims as part of the board exam. So it looks like laying out the problem, why it matters, and then what could be done.
And I would think also, given what you know about your audience and questions like the ones I raised about, for instance, budget issues or some of the limitations, it might be good to, you may want to think about tailoring some of those specifics to the healthcare facility or the city or municipality you're talking about, just because that could help make a strong case for really enacting that right here and right now in our city, wherever we find ourselves, so that we can support and protect the victims who are coming to us every day, and in the process create a better, stronger community and more adeptly, or and even more fulfill our obligation as medical practitioners to serve them, to protect them. As you can see, I love talking about this stuff, so I'm going off on a rant, but I think that is a fabulous start to a message and just a great way of evoking some of the concerns.
Yeah, and Wadeen Renee also had an example. Look, it sounds to me like it's happening in trying to communicate within an organization. But Laura, did you have a comment?
Well, I just wanted to mention in the sample message that we saw from Karen, there was a really strategic use of a statistic, and I think that is something that in sort of defining a problem and why it matters, and the upcoming guide that will be released in August, we'll talk a little bit more about the balance between statistics and storytelling. But I thought that in that specific example, the statistic was very compelling and directly correlated with the what should be done about it.
Yeah. Great. Let's see. There is another. Cassandra says the problem is boys don't see it as an issue they should care about. So talking about engaging maybe men and boys, it matters because sexual violence is not just something that impacts a single gender, but affects all genders. They are members of the society that they live in, and what is needed is better to reach the boys and help them understand why they should care.
So that's so interesting. So what I would love to know a little bit more about, if we were kind of working on a message strategy together, is sort of a little bit more about what that would look like, that reaching boys. Is that maybe an investment in Start Strong or Men Can Stop Rape? Would that be, because I think a little bit more clarity around what that awareness would look like would help strengthen the message and make the case, because as it is, it might be a bit challenging to just say culturally boys need to, or there just needs to be more done to reach men. Mm-hmm. That's a little bit too broad, or not too broad, but it's a little bit broad, and I think it could maybe benefit from a bit of narrowing around those 5 questions. So who needs to do the outreach? Who's going to get outreached, et cetera?
I think another interesting aspect of this example too is like we need to think about who our audience is, and so if the audience of the desired action is actually boys, that we need to make sure that we're describing the problem in a way that is compelling and relatable to that audience, and again needing to think specifically, because boys or young men or any group isn't just one one lump of people, but sort of identifying the unique characteristics of that audience and making sure that we share messages in a way that validate their identities and values.
Yeah, absolutely. I think wouldn't it be great if we could if we could each come up with our message and then have you both workshop it for us? That would be helpful.
That would be fun.
Yeah, it would be. But I think Helen raises a point about storytelling, and I think that came up when we were talking about values, is that sometimes when you can communicate about an actual people and put some storytelling behind that, sometimes that can speak to groups. Is that something that you would agree with, Pam and Laura?
Oh, absolutely. I think there's nothing like the power of what we at BMSG call an authentic voice. So someone who can really share the lived experience of what it feels like not only to be part of, to have experienced the problem, but potentially to be an advocate or somebody working towards the solution. And one of the things that I really love with storytelling, and when I work with storytellers, and I need to track down the gentleman who gave me this equation because it's fabulous. He works with Building Healthy Communities in Central California. That's the best I can say right now, but I will find it eventually. And he was talking to me about he works with a lot of youth who are very, very powerful storytellers, who can really give a face and a voice, as we're seeing in the national discussion around school violence right now. Who can give a tremendous face and a voice to making the changes that we want to see in the world. And he talked about how he works with youth to equip them not just to tell their story and stop there, because that can keep us really in that tight individual frame. Well, your parents shouldn't have let you go out that night, or you shouldn't have done this, or your parents shouldn't have done that, or maybe even that person was just a bad person. That keeps us really tight there, and it stops the conversation. But we can take that personal story, and if we can attach it to a piece of data and a solution, now then we're in business. Then we've got a story that's going to help us move the conversation forward. And what I'm thinking about is the example of trafficked people in healthcare that was raised earlier. And I'm thinking about that 88% statistic, which is just shocking. And I'm thinking, if you had someone who could tell a story of seeking health care and not getting it and the impact of that, then connect it to that statistic, and then connect it to, I don't want anybody else to go through what I went through. And that's why we need, whatever the change is. That really helps elevate that personal story, put it in a context, and make it an agent of change instead of sort of just telling the story and stopping there, which, again, as we know, just keeps people really tight and close in that individual personal responsibility, pull yourself up by your bootstraps kind of frame. So again, I would say in sort of equation form, because as you can probably tell, I love my equations and my visuals, a personal story plus a statistic plus the solution can be a very, very powerful way to use personal stories to affect that broader change.
Mm-hmm. Yeah, thanks, Pam. Rachel brought up a point or a question looking at incorporating storytelling, but I think maybe this would apply to any message that you craft while remaining trauma-informed with audiences and recognizing that, there are survivors in any audience. And so do you have any thinking around remaining trauma-informed when you're thinking about your messaging, whether it's storytelling or a different type of message?
That is a great question, Rachel, and I think it's something that it's a great question to raise as we're talking about the importance of authentic voices and the power of storytelling, because there is absolutely like a lot of responsibility to storytelling and working with storytellers. There's absolutely many ethical considerations that knowing that our storytellers and those who share feel as though they have agency or informed about the process and any for instance, any potential privacy or confidentiality concerns in being a storyteller. And I think that what Karen is also referencing is the double-edged sword of narrative, is that sometimes a story can be so specific or so detailed in a way that it brings people into that portrait landscape versus sort of the again, thinking about the broader and bigger picture. And so I think for that reason, it's really important for the incorporation of story and storytellers to be something that is a process that involves, conversations, information sharing, and empowerment, and really discussing the desired outcomes, not just from the strategic messaging point of view, but there's often a point of view and desired outcome from the messenger, and in having those conversations in a way that's respectful of that person's voice and their experience, but also letting them know that that there are there's the potential to strengthen the impact of a story by either avoiding triggering details or focusing on details that of course invoke the landscape and environment and are consistent with the overall strategy.
Great. Thanks, Laura. And Linda pointed out that there's some really great resources around trauma-informed storytelling. So maybe we could get some of your favorites, Linda, if you have a moment to put some of those in the text chat. So I think we should move to looking ahead. And so Pam and Laura, I did include some of these questions in our evaluation survey that I hope you all will visit and let us know your thoughts and answer these questions. But did you want to say a little bit about looking ahead and what we can expect down the road?
Sure, I'll take a kind of a first pass. I would say all of this has been just such a rich discussion. I'm fired up to go keep doing my writing on the final product that Laura mentioned, which is debuting at the National Sexual Assault Conference in August in Anaheim, and will be widely available through online and through other resources. One of my many dreams is to get it online at some point, so stay tuned for that. I call it the final product, but I don't think it's not the final work at all, because as we see, this work never goes away, and it never stops being important to do this messaging and to be effective communicators, to help people fight their way through what can feel like an overwhelming landscape and problem towards some kind of hope, towards some kind of structural and strategic change, towards the things that we know need to happen to build communities, environments where sexual violence can't happen. So in the immediate term, I would say keep an eye out for additional trainings and rollouts as we get ready for August. Keep an eye out in August for the release of the messaging guide and some affiliated materials with it. We'll try to make sure that it gets as wide a distribution as possible, and also we'll be definitely trying to be out there doing some of the training and consultation needed so we can have conversations like this one in real time, where we can workshop messages and talk through strategy and affect some real change together and separately. I would say those are kind of the top line things that are coming up in the immediate. I mean, I think in the long term, we plan to certainly continue to elevate and explore what we've learned, and I'm very, very anxious to keep working in this space and with folks. So if there are opportunities that come up or places where you feel like you would like to talk more about strategic communication and messaging, I do sincerely hope that you will reach out, and I'll have the opportunity to collaborate with you.
Thanks, Pam. So, I mean, we would love to hear from you all about what you would like to learn more about in terms of communicating effectively around prevention, and if there were topics that or points of discussion that came up today that you feel are most relevant to your work, we'd also love to hear about that. And feel free to put that in the text chat before you hop off, or again, I encourage you to respond to the evaluation survey. We do read all of your comments, and it's really useful in deciding where we go next with our web conferences and topics. So I want to, before I pass it back to our guests for closing, I just want to say that this web conference has been recorded. It will be available within the next couple of days. And so you will receive an email when that's ready for viewing. And right now the PowerPoint slides are available. The framing brief is available for download. You can find all of that on preventconnect.org. If you have questions or any comments, you're welcome to contact me directly. You all have my email address now, so feel free to, to send me a message. But I just wanted to thank Pam and Laura. Thank you so much for walking us through this work that has been, a long time coming and is still happening. It's been really interesting and useful for me, and it seems like it really resonated with folks in the audience.
Well, thank you for having us, Ashley. This has been phenomenal. As you can probably tell, I love this work and this community, and I'm incredibly excited to be releasing our messaging guide and continuing to work with anyone who wants to better make the case for preventing sexual violence, whatever that looks like, wherever you are. And as I said during my Ignite talk at last year's NSEC, ultimately, hopefully raising my daughter in a generation where we don't necessarily see this as an inevitability that we just have to deal with the fallout of, that we have the opportunity to live the values in the community that I think people raised and highlighted today. And I'm so delighted and proud to be in this work with all of you, and I want to thank you all for all that you do and for being here today.
Thanks, Pam. And I just put a link to your Ignite talk that you mentioned in the text chat. So if anyone wants to see a great, quick, I think it was like 5-minute presentation by Pamela, you can check that out there. Any last words from you, Laura?
Yeah, it was such a pleasure speaking with you all today. It's been amazing just to hear the feedback in the chat and to see the great additional questions that you all are asking, which are so helpful for Pamela and I as we're continuing to work on that final messaging guide and thinking about our future work in this area. And I love that you all are everyone is sharing resources with one another and following up on each other's questions. And this is just such a fantastic community of practice to be a part of, and it was absolutely a pleasure to join you all today, and always a pleasure to be working with Pamela Mejia at BMSG. So thanks for having us.
Yeah, no problem. And thank you all for participating. Thank you for those of you who tried out that messaging.
Yes, thank you so much.
Yeah, that's so great. But you all have a wonderful rest of your Thursday. And there is a certificate of attendance available at the end of the evaluation survey. So if you're looking for that, that's where you will find it. But you all take care, and we will see you back online real soon. This ends our web conference for today.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.